Easter. All right.
Laurie Bourdeaux is presenting her DNP defense. Thank you for coming on.
Thank you for having me.
Appreciate it. Right.
Are we starting?
Speak loudly.
We're starting?
Yes, we're going to go ahead and
Okay.
start.
Okay. Okay, so thank you for coming. No, you didn't have a choice. I'm at a project here, employing a guided breathing intervention to reduce test anxiety in first semester associate degree nursing students, which is a mouthful. This is my guided breathing device here. Yeah. So my problem statement here is not really a statement the way I've set it up, but 80% of nursing students experience moderate to severe anxiety. That's what studies have shown. And students with moderate to severe anxiety exhibit worse test scores than students with mild to no anxiety. When I did this study, 83% of their LPN students now working on their ABN impacted by this project had moderate to severe test anxiety. So that's right around with that 80%. So we were right on level there. I had 18 female licensed practical nursing students completing their associate degree in nursing at New River Community and Technical College in rural Greenbrier County, West Virginia, way down south. The mean age was 32.8 years. This wasn't a young group. The intervention was this little guy here, our breathing buddy, once a week for 7 weeks. She wanted me to stop at 3, and I really didn't want to do it because they were enjoying it. And I feel like 3 weeks wasn't enough time. However, now that I know what I didn't know then, I probably should have stopped then. I'll get to that. So the Harrison was having no intervention. We like this so much. The faculty that we're going to do it again this fall, and we're going to do it with the students just starting the program. So they're starting the practical nursing program. That's a big group. We're going to have a control group. Wow. Yeah, so I'm not going to get credit, but I'd like to keep doing this because I think it might work. I was looking for a decrease in test anxiety 5% in 7 weeks. That's not a lofty goal, but
Are you able to see it on the screen?
if I put my glasses on.
Oh, you're all right. You're all right. I'm sorry.
Do you want me to not turn around?
Oh,
I can put my glasses on. That's fine. Okay. So the background is significance. When you have anxiety, so you now take a test, it activates your sympathetic nervous system, which causes physiological changes. It increases your blood pressure, your respiration rate, your heart rate, causes muscle tension. That leads to physical changes, nausea, diaphoresis, headache, lightheadedness, and cognitive changes, confusion, and forgetfulness. You don't want to have this when you're taking the test. We talk about anxiety. We're going to talk about generalized social panic and phobia. Phobia, I'm going to talk briefly because phobia related induces something called state anxiety, which you had me define, which was good because I kind of thought it was just temporary anxiety, and it is. It's temporary emotional state leading to worry, nervousness, and fear. So an example of that would be if you're afraid of snakes, the snake comes into the room, you freak out, you're anxious, take away the snake, you're fine. How that relates to test anxiety is mild test anxiety is state anxiety. You go in, you're going to take a test. Oh no, I'm going to take the test. Finished, you're fine. Becomes a mental health disorder, which could be test anxiety when it's chronic and it produces moderate to severe impairments. It interferes with your activities of daily living. So when we talk about anxiety versus fear, people might say, I'm afraid I'm going to fail this test. If they say, I'm afraid I'm going to fail this test right before you go in to take the test, that's just a mild state anxiety. When you're finished, you're done, you're over it. If you say that every day, week leading up to the test, you might have some test anxiety. I'm afraid I'm going to fail this test. Then you're consumed with that. That's test anxiety. So that's the difference in state anxiety and test anxiety. Gaps I found in knowledge, there wasn't any long-term studies here. Now, when they worked on this, short breathing exercise, did it actually continue to work? I don't know, there hasn't been any study doing that. Interventions, I haven't seen any in healthcare settings, although that's where I learned this one. Faculty's training, I haven't seen any faculty actually trained to help with a breathing exercise. That would be nice to see. And then something that I thought of that we really haven't discussed either was tests, anxiety versus retention rate, because I'm all caught up in retention rate right now because I'm a director of the nursing school, so I don't want to lose anybody. So am I losing because of test anxiety? I don't want that to happen. I'm going to tell you a little bit about him real quick. So I was at Berkeley Medical Center, and on the behavioral health floor, we were having a patient one day who was having a panic attack. It was severe anxiety. And the licensed therapist brought this out of her desk, turned it on, and had him follow it. You breathe in for the 5 seconds, and then he turns to another color, breathe out. We used, there's 2 and 3, there's a setting for 2 and a setting for 3. We tried it different ways, the students, and they decided they just wanted the 2. When it turns purple, you breathe in, you hold it, then you exhale. It was long enough for 5 seconds just to breathe it in, and then for 5 seconds to let it go. So we found the 2 worked. But I saw this actually work on that person. So I thought, hey, do that breathing intervention. We'll see how it goes. They really liked him. I think having something to look at distracted them as well. So this was our hypothesis. Either guided breathing will reduce test anxiety in nursing students, or it won't. And here's the concepts. We already talked a couple about the anxiety, the tension, worry, physical changes, test anxiety, and state anxiety. Breath work is just the practice of breathing, which apparently we know how to do when we're born, but we seem to forget as we age. I know none of us probably in here do diaphragm breathing, belly breathing. Mindfulness is just a state of awareness, and breath work is a huge part of mindfulness. Empathy is, your ability to put yourself in someone else's shoes. The health disparities, I got off at CDC. I'm going to read this one. Preventable difference in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. We have that in my county down there. There's a lot of health disparities. And that's why my mom is there now. I think we're going to move her because she doesn't have any health issues now. But when she does, we're a good 2 hours away from decent health care. And we need to think about that. High stakes testing, which we're not supposed to do anymore. ASIN, I was just at an ASIN meeting, accreditation meeting, and they're like, we need to get away from high stakes testing. Mental health, this comes from the APA. State of mind characterized by emotional well-being, good behavioral adjustment, relative freedom from anxiety, and disabling symptoms, and a capacity to establish constructive relationships and cope with the ordinary demands and stresses of life. We should all wish for that. And then nursing education, just, educating nursing students, college level. So our goals, pretty easy. I wanted to determine their anxiety level. To do that, we used a WTAS, which is the Westfield Test Anxiety Scale. It's been vetted. It's been around since 2007. It's 10 statements. 10 statements you answer 1 to 5, 1 day. It took 10 minutes. And then we want to provide the intervention. That was our second goal, to reduce anxiety. And the timeline for that was once a week for 7 weeks. And then determine the change. So we had to administer the test again and see if there was any change in test results. I call it a test. It's really an assessment. So here's the PDSA cycle for this. The plan we did the first 3 chapters, submitted them to the IRB for review and approval. And then I discussed and demonstrated the little breathing guide here. with the students. I asked them if they wanted to be part of it. And if they did, to sign the consent form, they all wanted to be part of it. That was great. All of them weren't, all 18 started, all 18 finished. And then we administered the test the same day. So the intervention went on for 7 weeks. Each week I demonstrated I stood up there with them and demonstrated. Breathe in, breathe out. And we did it, it's for 5 seconds. Breathe in, deep breath in, 5 seconds, deep exhale through your mouth. 5 cycles. I've been reading since, I didn't know how many cycles to do, and everything seemed to be all over in the data that I looked at. Since then, I've seen that 10 cycles is kind of preferred. So when we do it this fall, we're going to do the 10 cycle. And then we administered the Westfield Test Anxiety Scale again. And then we looked at the pre and post assessments. I did a paired t-test. I automatically thought I did something wrong. And I sent the data to Dr. Johnson and Dr. Donovan and said, hey, can you look at this? Because my p-value was 0.003, which is really low. And Dr. Donovan quickly said, that doesn't mean anything. And I did realize that it really doesn't. But I was happy to get that. So we just rejected the null hypothesis. And we decided we were going to do guided reading again this fall. I'm going to share the results with the faculty. I've already shared it, but in the students via the PowerPoint presentation. And it's going to be presented at a state conference, upcoming state conference. Ethical. Of course, we all have to do the IRB. We're going to be dealing with people. There wasn't any obvious harm to these people. I told them before we started that it might help them, it might not help at all. It's not, but it's not going to hurt them. We got the informed consent, and we're going to keep everything stored in a lockbox and locked cabinet and locked office. The assessments are on paper, the consent's on paper, that'll be stored. Everything in the cloud will also be stored for 5 years and then deleted. That's what they asked for. Nobody will be contacted in the future. They knew that they could stop participating at any time. They could also participate and not fill out the form. It was up to them. No pressure. So this was my cost because I did not compensate anybody. They were all saying, oh, we should give them gift cards and all this. And I'm like, they're there anyway. They're taking the test. They can do it or they can't do it. And they all wanted to do it because we really wanted to know if this was going to work or not. And I told them, I don't know. I just saw it work on somebody else. It might not. So it's $23.27, including tax. So have you started yours yet? Mm-hmm. Okay. I kind of was a little freaked out about the framework, what framework would I get and what am I going to do? And this one was just perfect. And I'm sure I could have used another one and it would have worked too, but this was just perfect. Mm-hmm. And it's Hildegard Peplau, her theory of interpersonal relationships in nursing. And it emphasizes the nurse-patient relationship. And I had a interpersonal relationship to some extent with these students. I tried not to get to know them too well because I didn't want that to affect the test, the study, but they knew me just because I was the director and I had dealt with them coming into the program. And Peplau based her work on Harry Stack Sullivan, was another guy who didn't get all the credit he probably should have gotten. His interpersonal relationships theory in psychiatry. He developed a self system comprised of a good me, a bad me, and that's not me. And one of the main functions of that self system was to protect self-esteem and self-worth. And because threats to either one of those could cause anxiety. And anxiety was a major Peplau's theory. She broke it down into mild, moderate, severe, and panic. Mild was productive. A little bit of anxiety never hurt anyone. Moderate, a little stressful, but doesn't affect your activities of daily living. Severe and panic, you need a nursing intervention. Here she is. That was 1931, I believe. She graduated from nursing school. She was born September 1st, 1909, and died, I think, March 17th, 1999. So she was quite a while. Here's her framework. She had 4 phases. Orientation, where you build the trusting relationship, the rapport. Identification, that's where you identify the mental health disorder. Now, the patient needs to identify with this too. We did it through the WTS assessment. The students already knew they felt anxiety, but they didn't know to what extent. So that was interesting for them to find out. Nobody was surprised. No, there were no surprises. Exploitation, which I know it has a negative connotation, but that's what they used at that point. It's just the intervention that we applied. And then the resolution is goal met. Let me find that back in. Let's go back. Okay. The literature review. Nobody did exactly what I did. I was the first one to use this little breathing buddy, but other people have used devices that took your blood pressure for the most part. One had a breathing that went across your stomach. This man here, Barnable, he did the first one that was a device that you wore. Statistically insignificant, only 5 people ended up at the end, they dropped out. Another one for aromatherapy and anxiety. In the identification stage, ideally, you should ask them, about the goals, brainstorm. I didn't have that kind of time, and I didn't want to do aromatherapy or music. I'd seen this, and I'm like, this is what we're doing. So I deviated a little bit. If we keep doing this, maybe eventually we'll ask. And at the end, when I was finished, I did ask them to write on the WTAS. I said, if this did not work for you, write down what you think will. And nobody wrote anything else. So Driscoll, he's the one who came up with the test, so it is reliable. Another one, academic. This said it had insignificant impact on academic performance. Now, I've seen others that said it did. So it just depends. This one had 80% of the nursing was affected. Another one said that education of the parents was a significant issue. The Chinese one, perfectionism led to procrastination. I can totally understand that. Another one, tobacco use and emotional distress equate with worse test anxiety, while good self-esteem and physical activity alleviate it. That makes sense. This one, stress and anxiety related to high stakes examination was a significant problem with students in England. They have to take an exit exam. This was 5,000 students. They had issues with that. Another one, music therapy and aromatherapy. So, other things besides breathing will work. Anything to reduce that stress level. Household income and ethnicity affected. They're lower income and depending on which ethnicity. This one was elementary school, greater reduction in state anxiety in males and enhancing performance for students with higher sympathetic nervous system responses. So they did a breathing exercise too. This one was a huge study, but it gave you very low certainty of incidents. They used different resilience training. It turned out to be not so great. This one was also 64% of nursing students suffered abnormal test anxiety. This is quite a bit lower than the 80%. However, there were small sample size, 5 students. So I don't know if the 64% was accurate there. This is another man who's trying to get his DNP. Brief, virtually delivered mindfulness exercise. Now they did this, I think, over YouTube, breathing short. We're doing this breathing thing. They watched it and they did it. And they did see some benefit there. This is another one recently done. This is the one that you wore on their stomach, across their belly for breathing and to reduce test anxiety. And they found that worked as well. So that was like mindfulness, concentrating on your breathing to reduce your anxiety. This wasn't a test, but 99.98% retention rate, which I'm interested in now, resulted from implementation of student success program. And that was programs within the school system to deal with stress, student stress level. And then another one of the WTAS, again, found it was good for identifying test anxiety. Females reported higher levels of test anxiety. And this last one that I like, a meta-analysis, CBT, coping skills, and social support interventions were effective for reducing stress. Relaxation training, mindfulness-based stress reduction, and psychoeducation were better for reducing anxiety. Mine was mindfulness-based stress. So here's the Westfield Test Anxiety Scale. They answered the 10 statements from 1 to 5. 1 being comfortably low, 5 it's like, yes, this is affecting me all the time. So remember these. I'll come back to them. So pre-intervention, the test anxiety mean was 3.7. So if we look here, 3.7 is high anxiety. Post-intervention test anxiety was 2.9. So it dropped to just high normal. We're glad to see the normal in there. Decrease in mean was 21.6%. That's quite a bit more than 5 that I was taking before. And like I said before, pre-intervention, 83% identify with moderately high to extremely high test anxiety. Post-intervention, 44% identified with moderately high to extremely high test anxiety. So it was almost cut in half. Pair t-test showed statistically significant p-value of 0.003. You were happy about it. Dr. Donovan didn't. Okay, so the p-value indicates strong evidence against a null hypothesis. So there's a high probability that the change was not due to random chance. And you're like, oh, good, it works great. Well, we haven't gotten to everything. So we had to get rid of the null hypothesis. Guided breathing will reduce test anxiety in nursing students. And I do think it will. So here was their level beforehand. Extremely high, we had 6 students. Post, we had 1. And where we had none before, we actually had 1 who was comfortably low when we finished. So there was a decrease, but not in everybody. You can see here from the green, a couple people like G, H, M, and they dropped quite a bit. But if you look at I, they went up. J stayed the same. L went up. R stayed the same. We had 4 students who really were not affected. I was surprised. Now we'll get into a couple of the statements. There was one statement where 4 of the students had gone from a 5 to a 2. That was our biggest decrease. And 5 would be extremely or always true to slightly true. So one was the closer I am to a major exam, the harder for me it is to concentrate on material. Started out as always true, ended up slightly true. During the important exam, I think I'm doing awful and then I may fail. And that went from a 5 to a 2. So talk about the literature. Guided breathing did prove beneficial, and we've got the people I already discussed: Barnable, Ovadia Bleckman, King, I guess is his name, Nolan, Walker. They all kind of said the same thing, that guided breathing is beneficial. And as far as the framework goes, her Peplaw's theory was appropriate. We did have an interpersonal relationship. These scores, I said, were no surprise. We did not brainstorm, like I said, didn't have the time. They actually, when we finished, had a couple more weeks of school, and they wouldn't let me take it away. They continued to use the guiding breathing device on their own in class each week. And they did something that I hadn't done. I just did it before class started. And I talked to you originally about this. They actually decided to leave it on throughout the whole test. So that was interesting because I didn't say anything either way. And they said, no, if we get anxious during the test, we can just look up there and then refocus. That was nice to know that from the students. We give them a lot of support, which just may lead to a decrease in test anxiety over the course of the semester. I didn't start this at the beginning of the semester because I knew everybody's freaked out at the beginning of the semester. So I started it and I think they had taken 3 tests. So they were, I think that was a baseline. And then from there, what are we going to do? So here are the strengths. They were grateful. They were very grateful that we were willing to try anything to help them. So they were all willing to work with us. They chose to continue using the guided breathing after the study was over. It was inexpensive. It was quick. It was easy. I would definitely do that again. The weaknesses, it was still a small sample size. Granted, it wasn't 5 students, but it was only 18. Homogenous. They're all rural females. We generally have males in the group too. This was an unusual class. We had no males. There was no control group. I didn't like that. There's always a self-reporting bias. The WTAS is a great tool, but you never know how you're feeling from one day to the next. So it can never be 100% correct. I didn't know this, but halfway through, one of the faculty decided to start giving review sessions once a week via Zoom. And I didn't know that until I was finished. And she's like, I didn't think about what you were doing. And I said, who came and when? She says, I know at least one of them came. At least everybody showed up at least once that last 3 weeks. And then, they may have just grown accustomed to testing over 7 weeks. So there are weaknesses here. Next time we do this, we're not going to be doing review sessions during that time. So with our implications, I think it would be nice to recommend breathing exercise as a first-line treatment for stress and anxiety. It's something that we all need to learn to do, including me, and I try to actually do it now. Treat patients in facilities with acute anxiety using guided breathing intervention. Like I did see it being used, but that was one place. I'd like to see it used more places because it was definitely effective for her. In the future, I'd like to compare the long-term effectiveness of a self-guided versus the device-guided. And this could be used either way. And then integrate guided intervention into clinical settings, because I have not seen it. Most of them have been in nursing students. So my conclusions, it was successful. I think that if the students can master, these are nurses, master their controlled breathing will help them relieve their stress and prevent burnout, because it's stressful being a nurse. If they could learn that self-empathy through their controlled breathing, then maybe they would be a more empathetic caregiver to their patients and patients who are suffering with anxiety. If they could carry this skill into their nursing and use it for students, that's our sustainability. And Dr. Johnson had me add this, and it's a good quote: breath is life. We should pay as much attention to it as any other aspect of beingness, which I totally agree. And then I've got lots of references. Mm-hmm. Questions? Yes, hit me.
So I have a question about if you, I know this wasn't something that you were testing for, but I wondered if you noticed any impact on the students' test scores.
That's not something that I was looking for, and I didn't want that to be part of it. Mm-hmm. So I didn't. I mean, I could go back and see that data. I could get that data if I wanted to, but I did not specifically do that because it was not part of it. But it's interesting because one person said it didn't affect test scores, another did. So I don't know, maybe we can do that this fall.
Which is, you really weren't looking at performance, improving performance as much as you were just wanted them to be able to and tap into what they already had.
Right. I did not want to look at the test grades. And I told them right out front, I'm like, it's not about testing. It's not about your grades. It's about how you feel, how anxious you are. And I did have one student fortunately, after it was over, she might have been that one still extremely high. She said she was going to the doctor she had just gone. This is about a week later, because I was glad it was already over. She went and got Vyvanse and Zoloft. Her anxiety was so extreme. And I said, you you've got that documentation from your doctor, you can use that when you go to take the NCLEX. Because you can get accommodations for test anxiety if it is documented. She's a funny case because the teacher was just talking about some of you are going to fail if you don't have your information, if you don't have your work in. And she happened to glance at this girl. And after the class, the girl comes sobbing into my office. And she's like, I'm failing. And I'm like, no, you're not. So if you're failing, I would know before you knew. So you're not failing. And she's like, no, Dr. Simpkins just said that that we were going to fail if we didn't get our work in. She looked right at me. So I talked to the teacher and she's like, yeah, I just happened to look at her. It wasn't, I'm like, you're going to have to try really hard. Don't look at this student at all because she is just so high strung. She's still in the program. Nobody failed and nobody was in danger of failing during this. So it's not like some people got real anxious because they're failing. It was pretty much the same throughout. Nobody was ever in danger of failing others. So I wanted to make sure of that.
Was their participation, was it actually visible?
Well, yeah, when I was standing up there looking at them, they were breathing in. None of them breathed out their mouth. They were breathing in and out.
So you could actively see that they were engaged.
I wanted to make sure that they engaged because they could have dropped out any time, and I'm like looking to see, oh, has anybody dropped out? Are we still doing this? Does anybody still care? They were doing it.
And how do you control for the bias of the fact that, I mean, did they know that this was like your doctoral project?
No.
And so
No,
you did not.
No.
Okay.
No, I don't know if anybody else told them, but I didn't tell them. I said, we're just doing a study. I got to do this for school. That was it. There was nothing about that. I don't think they would have cared either way. Because like I said, I made it real clear to them that this might not work. I don't know if this is going to work. I saw it work on a behavioral health unit. I got the idea it might help you. So, you want to try it and see if this works. I feel like they thought, oh, is this going to work for me or not? I don't think it's like, oh, she's doing this study and now we got to be her guinea pigs. I don't feel like and I didn't approach it that way. And I don't feel like it's that way. I want to do anything I can to help them. This is important. So I feel like they thought that too. And that's why they were so willing to participate. They know we go out of our way to do anything we can to help.
I think that's it's such a positive step forward for nursing education to do activities like this, because it really does communicate that we care and we want them to succeed. And
that we want them to take this and go with them in life.
Yeah.
Because being a nurse, like I said, you're going to have struggles. And one of the things, I'm in part of this statewide grant that I noticed Shepherd's not in, for competency-based curriculum. We're going to add it to adding it to our concept-based curriculum. That they've noticed that students, when they graduate, these new nurses, they can't stand the stress. It's very stressful for them. They don't have the assessment skills that they need. They don't communicate with anybody like they should. That's our big competency things that we're working on in the state. So I thought, well, this goes with that too, because they can't handle the stress. We've got to deal with that somehow.
Dr. Zerl, do you have any questions?
I do. Thank you for doing this important work, because anxiety is very high in nursing students across the board. My first question is, you chose a population of LPNs, meaning they already had a nursing degree, right, and they're going for a second degree. What do you think implications are for first nursing program students based on your study?
That's the one we're going to do in the fall. So it could be completely different. And I don't know what the implications are, honestly. They could be worse because a lot of that crowd is younger. you can see the average age was 32.8. A lot of these people had been LPNs for years and then came back. So I don't know if that's a higher stress level from these older people who've been out of school for years, or the younger people who, I don't know. I'm interested to find out.
And one question, you may have said this and I missed it. Post-COVID, was there anything in your lit review that suggested higher test anxiety, particularly for those students who stayed home through several years of their school?
That's been a problem. You know, you do see that. I didn't see it in my in what I was looking at, but I saw it in other articles, not any of the ones that I picked up, but in other articles. Since COVID, it's been a problem. I think that's why we have this competency base for these health assessments and the stress, because that they said has been since COVID, that they really have seen a difference. So there are differences, but these people are older people. So not all of them were affected as students in COVID.
That's
You know, it's not like the practical nursing program that they were younger students. These are people are older people. So during COVID, most of them, I don't know, there might've been a couple of them. They weren't in school. These are people who are already graduating, were already nurses.
Okay, and then one other thought, just based on your literature review, based on what you saw with your EVP project, should there be a variety of resources available to address test anxiety?
Yes, I think so, because you see aromatherapy, you saw music. We should brainstorm, and maybe that's the next thing we should do is brainstorm. I don't know if I want to do it for the next one I do this fall. I mean, this can go on and on.
Mm-hmm.
But I think yes, I asked the students, if this didn't work for you, name something that would, and none of them did. But if I had tried music therapy, would that have worked? If I had tried aromatherapy, would that have worked? Would anything have worked just because they thought somebody was actually taking steps? You know, and that's, you got to look at that placebo effect right there, just because they care and they're doing this. So I didn't do it, like I said, because I didn't have the time to do that, to get into a whole different issue. And I'd already seen this one done, so I knew I wanted to do that. But yes, you're right, because breathing's great, but it might not work for everybody.
Okay, thank you.
Questions?
Do you think when you do it in the fall, try to add underground?
I think I want to stay close to this. I want to do the 10, and I want to do the control group. Other than that, I don't think I want to do anything different, because I want to try to keep not too, and I don't know about doing it for 7 weeks. I might limit that. We're going to talk, the faculty and I are going to talk, but I'm thinking 3 or 4 weeks. Well, I'll start it at the same time, several weeks in, and then end it after several weeks, and see if there's a difference.
What was the reason you said you opted to go the 7 weeks and now you kind of wish you hadn't done it?
Because she started the
okay.
yeah, about that same time, like the 4th week into it.
Can I ask about the review, but wouldn't you think that the review sessions would actually work in favor and decrease this anxiety, because they're increasing that knowledge base in the comfort?
Oh yeah, I think they decrease the anxiety, but maybe that's why the breathing may not have been working, because the tests, the review each week decreased it.
You don't know if it was truly the breathing.
Could
or-
they take
Right, so that P equals 0.003, a lot of that could have been because they were getting review each week.
But that's part of school.
Yeah, that's true.
Whether they get it formally at school or they do study sessions and review sessions together, they're getting some form of a review with the breathing, whether you provide it or they provide it or they do it themselves.
Yeah.
That's the nature of school.
Maybe we should do that from the beginning with our practical nursing students, is just do a review each week anyway. And then from the beginning, do a review each week.
Mhm.
I have another question. Did you do an assessment of before and after test anxiety after each test?
No.
Or was it all in? Okay.
Yeah, beginning, one at the beginning, one at the end. Everybody's done it that way. Nobody's ever done it after each test.
Because that might be, I don't know, it might detect situational stressors.
Mhm.
If it was particular to a certain test or certain topic, that's something to think about for the future.
Mhm.
To do it after every single test, and you know whether there was a review session or not, that if that affected your scores or could have affected your scores.
That's something to think about. I'll look and see if there's any studies that have done that. The ones that I looked at, none of them did that. But there were some studies where they only did it one time.
Mhm.
They looked at it before and after, and that's it. So, none of them did it as long as I did. They were very short.
Anything else, Dr. Zerl? Oh,
You
you're
can't hear.
still muted.
I think I'm good. Thank you.
Okay. Well, thank you for attending. So
Thank you.
appreciate you being here and awesome. So thank you all so much, and thank you, Candace, for
Yeah,
being
thank you,
here too.
We'll talk later. Tell me
Thank you
everything I did
all.
wrong.
Have a good day. Bye.
Mhm.
Bye-bye.